After a record-breaking week administering over 25,000 doses to first responders, teachers, and childcare staff statewide, the Idaho Department of Health and Welfare is welcoming a new group to the center stage.
Roughly 260,000 Idahoans aged 65 years of age and older that aren't living in long-term care facilities will be eligible for vaccine on Monday.
This comes after Governor Little announced that anyone 65 and older had been moved up in the priority groups and can start getting vaccinated starting February 1st. Public Health Administrator Elke Shaw-Tulloch acknowledges that that is an ambitious task, especially as Idaho only receives about 21,000 doses a week. That means if everyone who is eligible for the vaccine wants it, some may have to wait until May to finally get it. That means that Panhandle Health District will only get a certain amount of vaccines a week. So they say depending on supply, a tiered approach may be needed.
We are going to enhance our state websites to clearly explain who is eligible for vaccines and connect the people to the local public health districts' websites and call centers.
On Monday, individuals eligible for the vaccine will be able to find appointments with clinics in their area from the state website. They say the updated site will be launching that morning, so until then, you will not be able to see the option to book. Health professionals add that they are trying to be as fair as possible in regards to vaccine distribution. They are evaluating each health district's population numbers, how many providers they have, and how many vaccines are being ordered.
Are you or will you be addressing those who don't have access to Wi-Fi, who can't access a computer, or who maybe don't have cell service, so they can't find out this information? How are those people going to have access to the vaccine?
Sort of maybe non-traditional communication methods. So trying to get the word out through churches and faith-based organizations. Of course, we are relying heavily on technology, but we do know and are working to ensure that there are ways that hard to reach populations understand where they can get their vaccination and how to sign up and how to get an appointment.
DHW's Sarah Leeds says they are learning as they are going, as this process is new for everyone.
We're hopeful that we'll see an increase in vaccine available to us by late February or March. So if any additional types of vaccines are authorized, it will allow us the opportunity to vaccinate more people at one time.
Individuals in the 65-plus group who do not have access to technology can contact their health district, local pharmacy, or primary care clinician to learn more or schedule an appointment. Reporting in Spokane, Morgan Trout, KREM 2 News.